If you've just found out you have type 2 diabetes, or maybe you've been living with it for a while, you're probably wondering how you got here. You might even feel frustrated or overwhelmed, like you've been doing your best and still ended up with this diagnosis. The truth is, most of us have picked up daily habits that quietly chip away at our health over time, and diabetes doesn't just appear overnight. It builds slowly, year after year. But here's the encouraging part. Just as those habits created the problem, better habits can absolutely help you manage it, even reverse it. So let's take a walk through some of the most common habits that lead to diabetes and talk about how to gently steer away from them, without judgment, without shame, just with a lot of honesty and support. Number 10, skipping breakfast. Maybe you do it to save time, or maybe you just don't feel hungry in the morning. But what you might not know is that when you skip breakfast regularly, your body actually becomes more insulin resistant. It's like your metabolism gets confused because you're not giving it the fuel it needs at the right time. Then later in the day, you end up eating larger meals or snacking more, and your blood sugar spikes. Over time, this kind of pattern puts a lot of stress on your pancreas. Studies have shown that people who regularly skip breakfast have a significantly higher risk of developing diabetes. But here's the good news. Just by starting your day with a simple, balanced breakfast, think eggs and whole grain toast, or some oatmeal with nuts and fruit, you can help regulate your blood sugar and give your metabolism the rhythm it needs. It's a small shift that makes a big difference. Number 9, eating ultra-processed foods, those quick, convenient meals and snacks that fill our shelves and freezers. We reach for them when we're tired, rushed, or just need something fast. But the problem is, these foods are packed with hidden sugars, refined starches, and unhealthy fats that spike your blood sugar and trigger inflammation. It's not just about weight gain. These ingredients directly interfere with how your body uses insulin. One large study even showed that every 10% increase in processed food in your diet raises your diabetes risk by 15%. That's a big deal. But what's empowering is that even gradual changes, like cooking more meals at home with fresh ingredients or replacing sugary snacks with nuts or fruit, start to heal your metabolism. People who switch to diets like the Mediterranean diet, which focuses on whole foods, often see big improvements in their blood sugar and overall energy within weeks. Moving on to number 8, consumption of sugary drinks, those sodas, sweetened coffees, energy drinks, and even so-called healthy juices. They might seem like just a little treat, but they're one of the fastest ways to flood your bloodstream with sugar. Unlike food, there's no fiber to slow it down, so your blood sugar spikes quickly and crashes just as fast. If you're drinking even one sugary beverage a day, your risk of developing type 2 diabetes goes up by about 25%. It adds up quickly. But switching to water, sparkling water with fruit, or herbal teas can make a huge difference. And your taste buds adjust faster than you think. People who cut out sugary drinks often find their cravings reduce, their energy levels become more stable, and their blood sugar starts to respond much better within weeks. Number 7, sitting too much. Whether it's work, TV, or just screen time, our lives are set up in a way that encourages a lot of sitting. And even if you go to the gym for an hour, sitting for 8 to 10 hours a day still has serious consequences for how your body uses insulin. Being sedentary slows your metabolism and increases fat storage, especially around your organs. But here's where things get encouraging again. Just getting up every 30 minutes to stretch or walk for a couple of minutes can make a difference. And regular moderate exercise, like brisk walking or dancing in your kitchen for 30 minutes a day, can literally cut your diabetes risk in half. It's about moving more often, not just harder. Number 6, overeating refined carbs. You know, the white bread, the pasta, the pastries. These foods break down into sugar really quickly, and without fiber or protein to slow them down, your blood sugar goes on a roller coaster. If that happens repeatedly over years, your cells stop responding to insulin properly. That's insulin resistance, but switching to whole grains and complex carbs like sweet potatoes or quinoa helps stabilize your blood sugar and keeps you full longer. Even more powerful is combining carbs with protein or healthy fats, like pairing a slice of whole grain toast with avocado or peanut butter. These simple combinations retrain your body to handle sugar better and reduce those energy crashes that lead to overeating. Having no control for food portions and feeling the need to always clear one's plate of food is also a problem. Once you are not hungry anymore, stop eating. It is okay to stop eating before our bellies start pushing clothes out of the way. If you like this video so far, consider liking it and subscribing to our channel. It helps motivate us to continue making videos like this. Moving on to number 5, stress. We don't always think of it as connected to blood sugar, but when you're stressed out all the time, whether from work, relationships, or just everyday life, your body releases cortisol, a hormone that raises your blood sugar. Chronic stress literally keeps your body in fight or flight mode, which makes insulin less effective. And let's be real, when we're stressed, we tend to eat more, sleep less, and move less, which compounds the problem. But even 10 minutes a day of deep breathing, meditation, or walking in nature can lower stress hormones. People who practice mindfulness or yoga regularly show lower A1C levels and more stable blood sugar over time. It's not about becoming a monk. It's about giving your body moments of calm to reset. And then there's sleep on number 4. Most adults aren't getting enough of it. And when we don't sleep well, it messes with our blood sugar. Poor sleep increases insulin resistance, raises hunger hormones, and makes it harder to manage cravings. If you've been burning the candle at both ends, it's time to prioritize rest, not as a luxury, but as a key part of your healing. People who start getting 7 to 8 hours of quality sleep per night often notice their morning blood sugars improve, their mood lifts, and their cravings calm down. Creating a consistent bedtime, shutting off screens an hour before bed, and keeping the room cool and dark can work wonders. Number 3, eating late at night. Maybe you have a snack in front of the TV, or you eat dinner right before bed. But late-night eating throws off your internal clock and makes it harder for your body to process sugar. One study found that eating earlier in the day, even the same number of calories, resulted in lower blood sugar and better insulin response. So simply shifting dinner a little earlier or cutting off food 3 hours before bedtime can help your body reset. Over time, this small change can lead to weight loss, better sleep, and more stable glucose levels. On number 2, we have smoking. It's a hard one, but we have to talk about it. Smoking doesn't just harm your lungs, it damages your blood vessels and increases inflammation, both of which make it harder for insulin to work. Smokers are significantly more likely to develop type 2 diabetes, and it's one of the habits that can make complications worse. The empowering part is that within just months of quitting, your insulin sensitivity begins to improve. Many people who quit smoking not only breathe easier, they manage their blood sugar better and reduce their risk of heart disease at the same time. Number 1, carrying excess weight, especially around the belly. Visceral fat, the kind that wraps around your organs, releases inflammatory chemicals that directly cause insulin resistance. This is often the result of all the other habits combined. But here's the hope. Losing even a small amount of weight, just 5 to 10%, can dramatically improve your blood sugar and in some cases, even reverse diabetes. In fact, studies have shown that people who adopt healthier habits and lose weight steadily over time can actually put type 2 diabetes into remission. It's not about being skinny, it's about reducing the internal pressure on your organs so they can work better. And every step you take, every meal you improve, every walk you go on, it all adds up. So if you're feeling discouraged, please hear this. Diabetes doesn't have to be the end of your story. It can be the turning point. And reversing it isn't about perfection, it's about progress. It's about noticing your habits, choosing differently, and building a life that supports your health day by day. Start with one thing, just one habit, and let that be your foundation. You are absolutely capable of changing your story.